Hello and welcome to HDtv, Health District Television, brought to you by the Southern Nevada Health District. I'm Brian Gresh. First up today is an old public health nemesis, sexually transmitted diseases, or STDs. Not only are they not going away, the number of STDs is growing in our adolescent population here in Clark County and in the nation.
Unfortunately, sexually transmitted diseases are still a major public health challenge and concern. CDC estimates that there's probably 19 to 20 million people in this country that do get an STD. Some of them that we look at here at the health district are chlamydia, gonorrhea, and syphilis, but there's a lot of other sexually transmitted diseases that we don't even handle here, such as herpes virus, genital warts, the HPV, human papillomavirus. There's many STDs, HIVs included in that.
Perhaps it's the complacence about the seriousness of STDs, including HIV, now that medicine has allowed those infected to lead more healthier lives. Perhaps it's the misconception that there's a cure for all STDs, and they're no more serious than an inconvenience. Maybe the anonymity of internet dating is contributing. Or perhaps it's all of these and more.
I think when we talk about STDs, we're still talking about a stigma, whether it's in this community or nationally. People don't want to hear information about STDs, so there's not a lot of it out in the community, there's not a lot in the media, and a lot of times people are just not educated as to how they can contract an STD, what the signs and symptoms are, what damage can happen, and how easily some of them can be treated.
Basically, anyone not in an absolutely monogamous relationship between partners who have tested negative for an STD is at risk. And many times STDs in their early stages have no symptoms. They all have serious long-term consequences if not treated. The best way to protect yourself is through education, testing, and honesty with your physician, as well as your partners.
Anything done here at the health district, we are a medical facility, and so we are bound by confidentiality. When we're dealing with STDs and HIV, we probably take that confidentiality a few more steps than normally what some people will do. For instance, anyone who has an STD, we like to talk to people and elicit some information from them, especially about partners.
That is probably one of the main issues preventing people from coming forward to be tested and treated. Worry that they will lose their anonymity and privacy, that everyone will know, and they will lose their friends and relationships. But nothing could be further from the truth.
People should not be afraid when they're asked to speak to one of our disease investigators. They will really give them a lot of health education, and we'll also sit down and help them try and figure out some of the partners. Now, we certainly do offer people the option. Sometimes people are in a monogamous relationship, but it's not mutually monogamous. And so they know that they really have had just one partner, and they would like to speak to that partner themselves and bring them in. And we do give them the option of doing that. We ask them to bring them in a relatively short period of time. But there are many times people really say, oh, I'm glad that you may be able to go out and tell people because I don't want to tell them. I don't want them to know that it was me.
Information about STDs, their signs, symptoms, testing and treatment options, and their prevention is available on our website, snhd.info. Also, medical professionals are always available at health district clinics to answer any other questions you may have. Think of it as a way to care not only for yourself, but for your partners and even your unborn children.
Pregnant women who have STDs can transmit STDs to their unborn child. For instance, if a woman has chlamydia and gives birth to a child, they may cause some very severe pneumonia caused by the chlamydia bacteria. You can also transmit gonorrhea to an unborn child. What we do and what we have done in this country for a number of years is when a child's born, you will notice the nurse take the baby and immediately put some drops into the baby's eyes. And that has been specifically as a prevention for that child getting gonorrhea in their eyes. Syphilis is a very big problem. When a pregnant woman has syphilis and is not treated 30 days prior to delivery of the baby, that baby will be born with congenital syphilis. If the child's lucky enough to be born, syphilis in a pregnant woman will cause stillbirth. It will cause death in the baby immediately after birth, and it will cause very severe neurological problems and growth and development problems for the child. A big problem right now is the economic situation in this community, in this country. Women who don't have access to insurance and are not seeking prenatal care are not getting that test until they go into the hospital to deliver. And at that point, all we can do is, upon delivery, treat mom and then treat baby. And that treatment for a baby after delivery is IV in the hospital for 10 days with penicillin.